வணக்கம். நான் டாக்டர் வசுந்தரா தியாகராஜன், பிஎம் ஹாஸ்பிட்டல்ஸ் நியூ லைஃப் ஃபர்டிலிட்டி அண்ட் ஐவிஎஃப் சென்டர்ஸ் டைரக்டர். இன்று நான் உங்களுக்கு இன்ட்ராயூட்ரைன் இன்செமினேஷன், அதாவது ஐயுஐ என்று சொல்வோம், அதை பற்றி கொஞ்சம் டீட்டெயிலாக சொல்ல போகிறேன். எங்கள் மையத்தை சேர்ந்த என்னுடைய கொலீக்ஸ் 2 டாக்டர்கள், ஒருவர் தமிழிலும் ஒருவர் இங்கிலீஷிலும் ஒருவர் தெலுங்கிலும் பேசுவார்கள்.
Hello, I'm Dr. Sharanya.T. I'm a gynecologist and infertility specialist from BM Hospitals New Life Fertility and IVF Center. Today I'm going to talk to you about the topic intrauterine insemination. So before we go into the procedure of IUI, let's talk about how any and every woman gets pregnant. Every woman has one uterus, 2 fallopian tubes and 2 ovaries. In every menstrual cycle, what happens is an egg is released from the ovary and is picked up by the fimbrial end of the fallopian tube. This is called ovulation, which usually occurs on day 14 of every menstrual cycle. During this period, if the male and the female partner has got sexual contact, then the sperms will enter the uterus and travel through the fallopian tube, and there is a region in the fallopian tube called the ampulla. That is where the sperm and the egg fuse, and then the formed embryo travels through the tube, enters into the uterus and gets implanted inside the uterus and thus develops into a baby. This is how pregnancy forms. What are the indications for IUI? We have male factor indications, we have female factor indications. Male indications would be low sperm count or absence of sperm count, which is called azoospermia, ejaculatory dysfunction, and the presence of something called anti-sperm antibodies. Female factor indications will be endometriosis, especially grade 2, and then hostile cervical conditions like cervical mucus problems, and any past procedures if they have developed any cervical scar tissue. The next indication would be unexplained infertility, or even if the male and female partner have some problem in regular sexual practice. Now, before we commence the IUI procedure, we at BM Hospital do pre-IUI workup. What is this pre-IUI workup? Basically, these are investigations which we perform for both the female and the male partner to see what is the problem that is causing infertility. Now, in the female side, we perform blood investigations, and mainly we do hormonal investigations, that is FSH, LH, prolactin, and also something called AMH, which will tell you about the ovarian reserve. And to see about the fallopian tubes, if they are patent or not, then we do a procedure called hysterosalpingogram, where we take an X-ray of the fallopian tubes after injecting a dye inside the uterus. Or we do sonosalpingography, which is we see the patency of the tubes through ultrasound. Next, we do a basic ultrasound, which is usually done on day 1 or day 2 of the menstrual cycle. Why do we do this? Is to assess the uterus, the endometrial growth or the endometrial pattern, and it should be approximately 4 to 5 millimeters. To see the ovaries and the follicles, to assess if there are any ovarian cysts, and to treat and take it up. Even if the endometrium is thickened, then we have to treat it and then take up a fertility treatment. In BM Hospital, before doing IUI, we do something called mock IUI, where we try to pass the thin flexible IUI catheter through the cervix to make sure that the catheter passes through the cervix easily without any difficulty. For the male factor investigations, along with blood investigations, mainly we do an investigation called semen analysis, where we assess the sperm count, the motility of the sperms, and the morphology of the sperms. Now, coming to the procedure of IUI. When you go through the procedure of IUI, you can expect 3 main procedures. First step is you will be given ovulation inducing drugs to make your egg or follicles in the ovary to grow. It will then be monitored by ultrasound, which is called Follicular Study. Then your male partner's sperm will be washed and injected into the uterus. Now, ovulation induction. From day 2 of each menstrual cycle, we give certain drugs in the form of tablets or injections, and these are called the ovulation inducing drugs, which will help the follicle to grow. And from day 8 or day 9, we ask you to come to do ultrasound monitoring. This is called Follicular Study, where we will be assessing the growth of your follicle either every day or alternate day. And once the follicle reaches 1.8 to 2 centimeter in size, we simultaneously during the follicular study assess the endometrial growth also, and they should be around 7 to 10 millimeter. And then we know that we are ready to trigger ovulation. So we give a drug called injection HCG, human chorionic gonadotropin. This will cause or trigger ovulation 24 to 36 hours later. Then we ask the patient to come 24 to 36 hours later for the process of IUI. Now during this process of IUI, the semen sample will be given by the male partner, and the process is called semen preparation, where the semen is washed and good highly motile sperms are separated either by a technique called swim up technique or by gradient method. And these highly motile sperms are processed and prepared, and these are injected inside the woman's uterus through a very thin flexible IUI catheter. 12 hours later, we ask the patient to come back and we check by ultrasound to see if ovulation has occurred, that is, if the rupture of the follicle has happened. Then we do the second IUI called post-ovulatory IUI. So at BM hospital, both the IUIs we do under ultrasound guidance, whereby we see if the catheter has passed the internal os and has reached almost near the fundus of the uterus. This whole procedure of IUI takes hardly few minutes, and once the procedure is over, we ask the patient to lie down in usual dorsal position for 15 to 20 minutes, and then they are allowed to go home. And then they are given no restrictions. They can continue their daily physical activities. But still, we give 2 weeks of luteal support in the form of progesterone, in the form of tablets or injections for 15 days for our patients. And we ask them to come back after 15 days, and we do either a blood test and a urine test to see if pregnancy has occurred. Before concluding about IUI, I just want to tell you a small point about something called donor insemination, wherein if the male partner has been confirmed by both investigations and semen analysis that he is azoospermic, that is absence of sperm count, then we can use donor sperms for IUI. And these donor sperms must be taken only from a registered sperm bank. Thus, IUI is a very simple procedure, and it is a daycare procedure where you don't need anesthesia, you don't have to be in the hospital for 2 to 3 hours, and you can get back home and resume to your normal day-to-day activities. If IUI done in a proper way with a maximum of 3 cycles, we can expect 20 to 30% success rate in each cycle. Anyways, I hope that you have got a clearer picture of what IUI is and how the entire procedure works and how simple it is. So if you have any other doubts, you can directly contact us through our center. Thank you.